Hi, this is Dr. Davis with Dr. Davis. We're currently sitting in the parking lot contemplating the future. We are definitely going to have twins soon. They're coming right by the beginning of the year. It's maybe into February, but I am scared shitless, to be blunt. And how are you feeling?
Well, they're scheduled to come out February 13th, and I am hopeful that they will stay in there until February 13th.
Yeah, it's you say hopeful because these are MoMo twins, meaning monochorionic, monoamniotic. They share the same placenta and they share the same baby bubble. So, um,
Amniotic sac.
yeah, baby bubble, same thing. So basically, there's some complications that could be had with
It's a
the.
high risk pregnancy. Twins already are a high risk pregnancy with preterm and with mom having possibly developing gestational diabetes or preeclampsia. But with MoMo twins, with them sharing the same sac, there is a risk of cord entanglement. So as the babies get older, they get stronger and they start to, take up more space, each one of them, they can intertwine their umbilical cords. And then the moment that happens, you can have a decrease in heart rate in one of the babies. So that's why with these kinds of twins at week 28, well, at least with my practice it's week 28, I will go inpatient.
Bye bye, mommy.
Yes, mommy goes into the hospital, gets checked in, and then I'll be monitored 24/7 with about, she said, 2 to 3 readings a day, just again to check on heart rate, just to make sure babies are okay. That way, if there is anything that happens, the moment that it happens, I would go down for a scheduled or an emergency C-section.
And I guess I would miss the birth of my baby
No,
girls.
you wouldn't. You'd get a call, and you're allowed to be in there. But of course, with COVID right now, guests are limited, and the biggest thing that's affecting my heart is knowing that I'll be away from Harrison, my
Harrison is our 23-month-old.
our firstborn. I'll be away from him for a month plus, depending on the situation,
I'm
depending where I
sorry,
go
babe.
in. Children are not allowed into the hospitals right now unless they are being admitted themselves or are patients themselves.
So I'm gonna break his legs. Get him into the hospital with mommy. One leg. Okay. I'm not gonna hurt the child.
No, we're going to rely heavily on FaceTime. And even right now, with our MFM appointments and our 1 hour plus long ultrasounds and our detailed Dopplers and all these things that are happening that I have to go in for every other week, they've been only allowing me, the patient, going in, and then Nick has to watch everything through FaceTime. But
Which really, really sucks.
we were
It's taking the
clever.
magic away.
We were clever. And I brought, since today was our first MFM appointment, I brought a tripod. And all the nurses were looking at me like, what's that contraption? I'm like, it's an hour long ultrasound. You aren't letting my support person come in, and he wants to be here, so he will be here, and I'm not gonna, you know, kill my hand over this. So it was really helpful during our appointment because I had him set up right next to me, and the doctor, she actually looked back and forth, as she was speaking to us.
Yeah,
I
I,
feel,
I felt like a real person.
I feel
Very validated.
and I was able to refer to Nick when it was questions that I, didn't know the answer to, and he was able to participate without me awkwardly holding a camera going back and forth. I feel like it was helpful. And so, like, at the end, another nurse saw it, and I was like, I think you guys should maybe have one for your practice, just because of the times that it is. Like, going to MFM is hard enough
That's
for,
maternal fetal medicine
right.
doctor.
So they're also obstetricians, but they deal with high risk pregnancies. So moms that, patients that go see MFMs are inherently in a higher risk place. Oh, I just said that, but like the mentality where we go in mentally, it's not like your regular pregnancy where you're just going in, oh, checkups, this. I mean, like every appointment, you can hear potentially bad news. So it's an environment that you want to have a support person with you. Unfortunately, during this time, mine can't be there, but he can be waiting in the car for 6 hours.
It was only 3.5.
I was there from 9 to 1. It's a long time.
You did not make it on time to your appointment.
9:30 to 1. Yeah.
But yeah, so we're excited about this. We're gonna catalog this entire journey and make sure that I guess our daughters have something to look at in the future and be proud of. There they are right there.
Mommy is currently 12 weeks and 3 days.
Yeah. And
And
she's getting big finally.
I'll go ahead and put out the measurements. They're not really measured right now. They're really small, but they're just from head to rump. I only saw one baby. I don't recall the other measurements, but like I said, I'm 12 weeks 3 days. One baby was measuring 12 weeks 6 days, and there was not a huge difference in size. I don't believe. Else nothing that she mentioned. I really wish I was a little more proactive asking the size, but heart rate was 168.
Got a little Brianna Tarth in there.
She's gonna be petite. What is it? One baby was 168, and the other is 165 heart rate.
So they're strong, doing well.
Chugging along, nothing, no discrepancies, I guess, in their heart rate.
And her pregnancy so far has been pretty awesome. The first pregnancy that we had with baby boy Harrison, she had the most textbook pregnancy you could have. No morning sickness at all, though.
Conception of it, but.
Oh yeah, I mean obviously we did IVF with him too.
But yeah, I didn't have any morning sickness. I mean, I have my bouts of nausea, and I never had full-blown vomiting or any emesis or anything like that. So I guess it's the same thing. I just said it twice.
Hopefully she doesn't get that, because she's not always the fastest to get to a plastic bag, but you know, she can keep it together.
We have one now. Right?
Yeah, we do. Emergency supplies. You need to keep one of these always.
It is gross that it's clear though. Think about it. Big thing, what comes out. I will get a different color.
Good advice for us all.
But yeah, so journey on the way for our momos. Names to be revealed. Names, they're in here, but we will reveal them later
after we have successful delivery. All right. Well, that wraps up our first video. Thanks for watching. Don't forget to subscribe and like us. All right. Have a good one.